principle of the ESTHER model is that what we should really be looking at is how services work together to meet the needs of the individual. And by meeting the needs of the individual, we're able to make sure that they're confident to stay at home if that's appropriate, and that they're able to then use A&E and acute admissions much less, but also don't have to go into long-term social care because we're actually meeting their needs.
I think it's really beneficial to actually have a name to what we all strive to do anyway, and we should all be person-centred care should be at the heart of everything we do, and it is, but I think to have that sort of model, as this is the model we're working towards in this area, is really beneficial.
The ESTHER project's fantastic. We're using the ESTHER principle for the way we're working around patient-centred care in the Vanguard and integrated case management, which is the first question we ask is what matters to our patients and who matters to them. We then bring groups of professionals together, of multi-organisations, to design one anticipatory care plan that meets the needs of the individuals and those caring for them.
The real concept of the ESTHER model of care is a fundamental different way of organisations and professionals talking together across those organisational and professional boundaries so that they don't get in the way, but instead are able to really meet the needs of the individual.
We choose the name ESTHER in Sweden just because it talks to your heart. If you talk about better care for frail elderly, that sounds quite abstract and scientific. If you talk about ESTHER, that's a common old lady's name, so that you picture yourself an old lady when you use that name. The principle behind it is to go from wondering what is the matter with ESTHER towards what matters to ESTHER, and to improve the possibilities for ESTHER to always get the care at the right level at any given point. Avoiding going to hospital, A&E or even primary care if she can get it at another level, if the care can come to ESTHER rather than ESTHER to the care. And that everyone involved to achieve this will communicate and collaborate.
It brings together really a lot of the values and approaches that we'd like to think we're always delivering. And whilst I'm familiar with all of the values and sort of approaches that have been discussed, it's really good to have a sort of coordinated sort of approach that brings all of that together again and provides a focus and very much around an individual, a sort of, if you like, a personification of every person, every service user. It's exciting in the sense that it can maybe unite people across services.
So this is true personalisation, whereby we're changing the framework and the communication with the person. It's also a way of changing expectations of both the professional but the citizen, and allows us to have the mission statement from our Design and Learning Centre, which is making out-of-hospital care safer for both citizens and the professionals, whereby care is both clinical care, social care, but also personal care.